Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over antimicrobials. So I know I've had this question quite a lot on my channel. What antimicrobial should I be using? So that's what exactly we're going to be going over today. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So there are so many different types of antimicrobials that you can actually choose from. Chlorhexidine, povidone iodine, honey, silver, phMV, acetic acid, methylene blue, jacentin, violet. What do we pick? Okay. When we have a local infection, so we're treating a local infection with an antimicrobial, and if you're confused of whether you should be treating with an antimicrobial or an antibiotic, check out my link above, and I will go over just how to decipher which one you should be using. But for this video, it's just going over antimicrobials and which one we should be using. So we have all of these that we can use. Now, which one do we use? I'll be going over each specific one, the indications, and when we should be using them, okay? So the first one that we'll go over is chlorhexidine, okay? So you will see many similarities to all of these antimicrobials, and the number one thing is using it for wounds with signs and symptoms of infection, okay? We do not want to be using antimicrobials on wounds that don't have signs and symptoms of infection. So using your nerds and stonies to make sure that you have a clinical infection before using this. The only other time that we use an antimicrobial is when it's at high risk of infection, okay? If it's in a high risk area, or if they had contamination where it's at high risk, then we can use antimicrobials because the benefits outweigh the risks, okay? With antimicrobials, if you have a clean, good wound that's healing, it will actually slow down the healing time. And this is a huge misconception with antimicrobials. Oh, if we use it, it'll just push it that much more. But it's such a misconception because more is not better in wound care, okay? And we also don't want to be mixing antimicrobials, okay? We take one, we use one, we stick to that one, okay? I've seen it where people are piling on products and they're using this antimicrobial as a contact layer and another antimicrobial on top of it as an absorbent layer, and we don't need this, okay? That just costs more money. It's unnecessary, okay? We shouldn't be mixing antimicrobials anyways, so just picking one, okay? So chlorhexidine, we're going to use it for wounds with signs and symptoms of infection, or if we're using it prophylactically, okay, for people who are at high risk of developing an infection. This is safe for all ages. A precaution is you're going to discontinue if skin irritation occurs, okay? I have seen it where people have had an irritation to the chlorhexidine, so you just want to discontinue use. And as you've seen, there is a ton of antimicrobials to choose from, so then we go on to the next, okay? Also, I do want to point out that normally we use an antimicrobial for 2 weeks, okay? If we have a really bad infection, okay, we need to be alternating 2 weeks, 2 weeks, because our body gets used to one antimicrobial. We need to be going on to the next every 2 weeks, okay? Contraindications. So we're not going to be using this in patients who have a sensitivity to chlorhexidine, and in this case, for the back to grass, paraffin, because it does have paraffin on this one, but not all chlorhexidines do have paraffin. So you just want to look, but I did just want to add that for this one, because this one is the mesh. So all these antimicrobials, they have so many different dressing choices, and I'll show you at the end, because they all come in a bunch of different forms, okay? I'm just talking about the specific antimicrobial. Now, whether you need a mesh, a foam, an alginate, that's going to be determined on the amount of exudate that we have. So the amount of drainage that we have to control. Okay. For this, we have a mesh here that I'm showing you. This is going to be low to moderate amounts of exudate. Now you can use it for heavy amounts of exudate. We just have to have a thicker, more absorbent layer on top. Okay. So whatever you're trying to control is what the form of antimicrobial. So I'm going over all the antimicrobials, but they come in different forms. So it can be on a mesh, it can be on an alginate, it can be on a foam. Okay. I will show you all the different ones at the end, but right now we're just going over each antimicrobial. Okay, so next we have povidone iodine. So indications for use. Once again, wounds with signs and symptoms of infection, or if it's a maintenance wound, okay, or a non-healing wound where we're trying to keep it dry and intact, or if we have a thick eschar scab on it, and say they have diabetes, we do not want that going anywhere because then it creates a higher risk of infection. So we'll just put povidone iodine over top to keep it nice and dry and intact. Precautions. We want to use cautions with newborn babies, infants less than 6 months of age. Avoid using before or after radioiodine diagnostic tests. And contraindications. We're not going to use this in patients who have an iodine sensitivity or allergy. We're not going to use for pregnant or breastfeeding women or any patient for extended period of time who have thyroid disorders. Okay, so we would definitely want to be talking to the doctor if they do have a thyroid disorder before we ever use iodine. I just kind of stay away from iodine in any patient with thyroid disorder. But to clean up a wound once is not going to hurt, okay? Okay, so next we have honey, okay? So it is specific for medical, so it is medical grade Manuka honey is what's used. So indications for use, once again, wounds with signs and symptoms of infection, wounds that have necrotic tissue slough, okay? So we can use this as an autolytic debrider, okay? It works quite well. We can use this for wounds with small amounts of exudate because it will increase exudate, okay? So precautions, it does have a low pH, so sometimes it does cause a stinging effect. Now, if somebody has taken a pain medication and still has a stinging effect after 30 minutes, I would suggest to move to a different antimicrobial. Another precaution is we're going to be very cautious with heavily exudating wounds because this can have effect of increasing exudate. And then contraindications, we're not going to be using this for anyone who has an allergy or sensitivity to honey. Next, we have our silver. So once again, indications for wounds with signs and symptoms of infection. I think we will get this be very clear by the end that we're using antimicrobials for signs and symptoms of infection. Now, precautions. We are going to avoid putting electrodes or conductive gels in contact with silver products, okay? Contraindications. We're not going to be using this on patients who have a sensitivity or allergy to silver. Don't use on surgical implants. We're not going to use on pregnant or lactating women because there's not enough information. Do not use silver products in combination with oil-based products or petroleum or paraffin. Okay. And we're not going to be using silver if a patient is undergoing an MRI or radiation therapy. It can be replaced afterwards, but we don't want it to be on them while they are having that therapy done. Next, we have acetic acid. So once again, we're going to be using this with signs and symptoms of local infection. Now, specifically some Pseudomonas, okay? So this creates a green drainage. You can always notice it because it has a green colored drainage coming out of the wound. And this works amazing. I have personally used it many, many times. And I've used it many times where a doctor is like, we should be using an antibiotic. This clears it up so quickly. It's amazing. Now, there is different concentrations that you can use. I will link a video here, just so you know all about acetic acid. And I have in there charts of how to make it. And how to dilute it, okay, for specific concentrations. So you want to start out at the lowest concentration and move upwards because it can cause a stinging effect. We don't want it to sting. Sometimes towards the end of compression time, it will start stinging. So we're using this, saturating a gauze and putting it on the wound to clean out the infection, okay? So we need to be making sure that it's not stinging them, using an appropriate concentration, okay? So contraindications, we're not going to use this for patients with a sensitivity or an allergy to acetic acid. We're not going to be using this in combination with any other solutions, so Dankin solution or iodine solution. And we're not going to use it for irrigation of undermining or sinus tunnels, okay? If you cannot feel how deep a tunnel is, okay, if you're probing and you can't feel a base, you should not be irrigating a wound, okay? That goes even for normal saline. If you don't know how deep it goes or how far it goes, you can't feel a base, do not irrigate, okay? Next, we have phMV. So this is, once again, for wounds with signs and symptoms of local infection. We can use it prophylactically for patients who have or are at high risk of developing a wound infection. It is safe for all ages, including neonatals. There is no precautions stated by the manufacturer, okay? Contraindications. So we're not going to be using this for anyone who has signs and symptoms of allergy or sensitivity to phMV. Do not use with Dankin solution, bleach solution, because these will deactivate the phMV, okay? We're not going to use this with any other ointments, creams, powders, sprays, petroleum-based dressings such as Adaptic, as they will create a barrier to prevent the phMV from attracting and killing the bacteria, okay? So like I said earlier, you only want to be using one product, one antimicrobial, one product, okay? One contact product. And then if you need the cover dressing, you just use a plain cover dressing. The only time that the cover dressing should have an antimicrobial in it is if it's the actual contact layer, okay? So for our last antimicrobial, we have Methylene Blue and Gentian Violet. So the only product that I'm actually aware of that we have around my location is the Hydrophera Blue. That's what we have. Now I have seen some other ones. Really, they're the same thing. Okay, so it's the pad that has this on it. But we use Hydrophera Blue here. So indications for use. Now I did put this more specific to the product because that's what we have, and really all of them are the same. So once again, signs and symptoms of local infection. You don't allow the dressing to dry out. Okay. We're not going to use this. It says 6 months. I don't like using any antimicrobial for any longer than 2 to 3 weeks, okay? 2 weeks, I normally like to do a change, and then we can change back after 2 weeks, that's fine, but I like to be changing it up every 2 weeks to make sure that our body isn't getting used to it, the bacteria isn't getting used to it, so we're killing off the bacteria, okay? Don't use for clients with known sensitivity to ingredients, and we're also not going to use this for 3rd-degree burns. So like I said earlier, that we were going to be going over the different products that each one of these antimicrobials can come in, okay? So we have like our gels, so our hydrogels. So this hydrates. Now there are hydrogels with like silver in it or antimicrobials in it, okay? So you just have to look and see, okay, I want this antimicrobial. Now, which form do I need in it? Okay. Is it a dry wound? Okay. What's the exudating? That is that is going to tell you what you need to use. If you have a dry wound, you need a hydrogel. If it's a moderate exudating wounds, I'd go for the hydrofibers or gelling fibers. If it's exudating a high amount, you want the highest absorbency right here with the alginates. Okay, so then say I have a high exudating wound. Okay, I want to use a silver antimicrobial. So what do? I need a high absorbency, so I pick alginate, and we find one with silver in it. Okay, so it's not that difficult to figure out what we should be using. Say we have a wound with just a slight amount of exudate, so a low amount of exudate, and we want silver. What do? So we have a mild amount of exudate, but right here on the scale, we use a silver contact layer. Okay, what if we have a moderate amount of exudate? Well, we go to moderate. And we find a gelling fiber with silver in it. Okay, so it's really simple once you start looking at it. Okay, if you're somewhere between moderate and a high amount of exudate, well, you pick a foam, right? So you find a foam with silver in it, and you can do the same thing for any of these antimicrobials. Okay, now there are some that don't have products. Or they might be missing one here or there. I've never come in contact with, like, say, a povidone iodine with an alginate, okay, for example. So you would use a different antimicrobial. So just look at what you have, okay? You look and see, okay, this is the type of antimicrobial that I really want to be trying out. And then this is the most important part, okay? If you have a moisture balanced wound, that is the most important part, okay? That is what's going to allow our wound to heal. We want a just moist wound, okay? About as moist as our eyeball, okay? That's what I tell people. That's how moist you want your wound to be, not too dry, not too wet. Okay, that will allow it to heal over. Okay, and there used to be a misconception to let wounds dry out. That's no longer the case. So that's like old technology, old way of thinking. Now we've done a lot of research and determined that wounds heal so much faster when we keep them in a moist wound environment. Okay, so you pick which one is going to provide just the amount of absorption, or just a contact layer, or even adding in moisture. Okay, so that is how you look at the products and use the antimicrobials and just plug it in to with what you should be using. Okay. So that's all I have for this video, guys. I hope it did give you a better understanding of how to choose an antimicrobial and which form you should be using. Once you understand that it's quite simple, where it's just plug and play. You just, okay, I need this form. let's add this microbial to it, antimicrobial to it, okay? But that's all I have for this video. I hope to catch you in my next one. Bye for now.